It is a partnership between patients and clinicians. It is a partnership between patients and CCGs, and it's a partnership across the health economy in terms of CCGs working together.
The most important event what's happened in patient participation is the fact that now the NHS listen and do take notice of what patients say.
I am just the average Joe, I am just a typical 20-year-old, but I can still come out and do this and understand what's going on, so anybody can, and I mean anybody really can. If I can grasp it, then I don't see why anybody else couldn't.
The project started about 5 years ago as a result of the feedback from the mid-staff's inquiry, looking at how we could bring together feedback from multiple sources into one place so that we could understand what patients were telling us from very different perspectives. We started then to think about how we could build a model of involvement to allow that feedback to go from practice level through to board level. We started to build a membership scheme. We started to develop some of the patient participation groups locally, and to make sure that patients could actually understand what was going on from a commissioning perspective, we started to develop locality groups which would look at local issues and start to work with local communities and patients to help commissioners develop solutions and services.
The great benefit to the system is that it's web-based, it's easy accessible, it has a dashboard so you can access the data real-time, so you can see the themes emerging before it becomes an issue.
The insight system is there to listen to patients and what they've got to say, so it's how we interpret that, how we convey that, and by using the insight system we can identify different elements, different subjects, and cascade that down to the relevant people, i.e. the CCGs.
It's about truly listening and acting on what patients are telling you and going back to them and showing the results and showing the changes in service. It is a partnership between patients and clinicians. It is a partnership between patients and CCGs, and it's a partnership across the health economy in terms of CCGs working together.
So it's really putting the patient voice at the heart.
The most important event what's happened in patient participation is the fact that now the NHS listen and do take notice of what patients say. Now they would say that the NHS has always done that. Well, I can here to tell you that the NHS hasn't always done that. They may have wanted to, but they've never had the means or the structure or the way to do it. This gives them that opportunity not only to listen, but to react to what patients are saying.
Day to day, it's going out and talking to people. So it might be anything from a couple of my team are going to a football match tomorrow. They won't be playing, but they will be meeting people at the gates and actually hoping to sign more men up to the scheme, because we know that generally men's views are underrepresented in the NHS. We try and go to the places that aren't necessarily the places that you'd expect to find the NHS. So rather than just going to very important PPGs and those condition-specific groups, we try and go out to community events, any kind of fun days. It might be a school fun day, it might be a sale in a church hall, anywhere where we know that there are going to be people that might not necessarily have an interest in the NHS. And when we sign people up, it's really important that they get a balance of information, not just about the NHS, but about other things that are going on locally. So if I've met somebody for the first time and they hadn't really got any knowledge of the NHS other than the services that they used, I'd want them to sign up to one of our membership schemes, because you start to understand how you can have your say, where you can have your say, and it really empowers people to be able to take a part in their local NHS.
The Patient Congress is made up of people from the membership, from the locality groups, Health Watch, and also third sector groups that have got very distinct kind of areas of interest, including drug abuse, homelessness and domestic violence and other areas based on their reach out into the community. Patient Congress meets on a bi-monthly basis, works in partnership with the CCG, is usually chaired by the PPI lay member, and the PPI lay member then reports directly back through to the board exactly what's going on from GP practice level right the way through in terms of patient involvement and engagement. The database and all the information that comes from the database is actually given to the Congress as well, so that the Congress can provide some challenge around what the CCGs are doing in terms of service development and listen to the patient voice and provide that oversight and scrutiny.
Surround yourself with people that are willing to work together, decide on how you're going to work, and then do not get distracted.
All 54 practices across Stoke-on-Trent, GP practices across Stoke-on-Trent have been trained now and are now actively inputting into the patient experience and patient safety data. We then have meetings monthly, and we go through all of those Datex reports.
So they can sit down at the weekend and say, well, actually, this is what a clinical commissioning group, this is what they're doing. I might come back to that, but actually there's this event going on in my community that I could take the kids to at the weekend, or the grandkids. I'll go and have a look around. And while they're there might be other NHS services, there might be Stop Smoking, there might be Change for Life. So they're actually linking into that bigger picture locally. So while one group might work with data, they will also come out and meet with patients and patient groups to understand what the message is out in the community, so that they're not working with data, they're working with people's experiences. And likewise for people like me who, I'll be honest, I don't particularly like numbers and data, but I really like the stuff that comes out of the other end. So people who work with the data will explain to me where it comes from so that I can see that bigger picture.
All of our quality meetings now start with the patient story, with the consent of the patients, obviously, and the governing body have now asked that they would like patient stories at our governing body meeting, so we're looking at the mechanism of making that happen. So it's really putting the patient voice at the heart.
The success of the project has been the kind of spread of the project, certainly in terms of the database and the patient experience element. That started in one PCT at the time 5 years ago. As CCGs came together, that then spread across Staffordshire to 6 CCGs, and the data in that database is actually reported by each of the individual CCGs, but is then shared across a health economy, so we can see themes and trends around providers, GP practices, services. It's also been then rolled out to Telford and Shropshire and Herefordshire, and over time we've rolled that out to the Lancashire part of the organisation, and there are 4 CCGs up in Lancashire using the information, so that's been a big success. One of the other successes in terms of the Insight database has been adapting the database to then also take in clinical effectiveness data and safety data, so that it's covering the full gambit of quality, patient experience, clinical effectiveness and safety. So it's both patient and clinical view in terms of themes and trends coming together, being reported in real time and being available to commissioners to review based on their portfolios of service, and also rolling it out to GP practices. So there's over 450 GP practices who have access to the system and are able to feed in.
For quite a small team, just focusing on North Staffs and Stoke-on-Trent, we've actually got 3,500 people signed up now to the membership scheme.
It's definitely important that the Congress and the CCG get the opinions of people who are in the system, but it's also important that they get the people who aren't.
There will be areas and associations that are behind us that are learning through the model, through us, and that will assist them in the way that they set their operation up.
I think it's really important that, we can't all do everything, but if we come together we can achieve so much more.
If you really are serious about this and you really want to know how it's going to happen, come to Stoke and we will help you to and tell you about the system and how we found it, and have that dialogue with us, because that's the best way of learning from each other.